normal range of motion on this wrist. This is about as far as I can comfortably go on this wrist without some pain going on. So a lot of reduction in that.
What's up, everybody? Back at you again with another focused Shockwave video here at Kalkstein Chiropractic. Got Dr. Nick with me. He's been adjusting people a little too much lately. So he's got a little bit of a strain right in the wrist. Dr. Nick, why don't you let everybody know what's going on before we start?
Sure. So let's see, started about 2 weeks ago. Noticed some pain, kind of central and focal to about this point here. Hurts with terminal extension, hurts a lot with flexion. So normal range of motion on this wrist. This is about as far as I can comfortably go on this wrist without some pain going on. So a lot of reduction in that. And I've had treatment once already with some Shockwave, followed up with some laser, but I just need to keep after it. It's been slowly getting worse, so I want to stay on top of things.
Battle of consistency for sure, especially with the normal wear and tear of your usual activity too.
Absolutely.
All right, so let's go ahead and get it started, guys. Dr. Nick, we're going to start you off nice and low, but let me know once we start to get to about that 4 or 5, okay? Nothing too crazy there, right?
No.
Okay, perfect. So let's go ahead and bump you up.
Right through there, I start to get it.
Is that already the 3 or 4?
And then
is it a little bit lower into here?
No, it's more, right through that region.
Gotcha.
And then where you first had it.
Kind of right there as well.
Yeah.
Gotcha.
It's such a unique sensation. I feel it. The most prominent sensation I actually feel on the underside of my hand.
Yeah, when we're doing the focused Shockwave treatment, it's very normal for like a radiation of pain or the pain to kind of travel away from where we are. And that referral pain is essentially your body kind of telling us like, hey, we're on the right spot there with the treatment. So that's good that we were able to find it so fast. Now, everybody knows at this point with the focused Shockwave that we really don't move around a whole lot. We're not doing that spot scanning or searching that we do as much with the other Shockwave here in the office. This one, an easy way to think of it is the focused Shockwave is almost like a sniper rifle. It's very precise. We're right on the spot that we need to be. Whereas our other Shockwave unit here, the radial Shockwave, is more almost like a shotgun blast. It's very widespread. We can use it as like a diagnostic scanning tool, as well as we can with the spot searching and, really kind of sitting on those points. But in terms of what the golden standard is, if you know the exact area of your problem, that's going to be focused.
And so it kind of looks like Mike is doing some scanning, but majority of what he's doing right now is just changing the angle at which that that focused wave is targeting the tissue. So of course you can hit it in a linear direction, but it's always helpful to hit it from multiple angles. Oh, that's a spot I didn't know.
Yeah, it's just a slight turn from the way we originally started. And a lot of the focused Shockwave treatment is going to be playing on those angles because Dr. Nick is getting a completely different response from when we have it angled this way versus when we turn it just right there. And I would say this... let's keep going. We got 200 more. I would say this is probably a little bit more extreme.
I noticed that a lot more than that other position, but I notice it most
when we're right over top.
Typically when it's perpendicular with that spot. Yeah, for sure, right through there.
Gotcha. So we're almost already done with our focused Shockwave treatment because this is such a I would say a bony region. It's a little bit more tender. There's not as much soft tissue around the hand and the wrist where we're at. The frequency or how fast the shocks are being delivered is going to be a lot higher than, let's say, a low back or a glute. So that was actually already our entire therapeutic dosage of the focused Shockwave. We're already done. We're going to get into some laser after this. The nice 1-2 punch here in the office is doing a focus shockwave or radial shockwave. We're starting the inflammatory process, and then we're going to go through with laser to rush through that inflammation. All right, guys. Well, this is our first segment of the video, doing the focused shockwave. Stay tuned for the laser, but
We're back with part 2 of treatment on my wrist. So I don't know if we can do angles. Can we do angles on the video? Can you show angles? That's like what, 90 degrees? It's pretty significant. That's a lot. And I started it out maybe about here when before Shockwave. You know, I maybe gained
10 degrees or so, maybe
10 to 20 more degrees. The discomfort or the pain isn't as significant, so the range of motion improved, pain dropped, all good signs. We're going to follow it up with laser. So like Mike said, Shockwave helps, I want to say destroy, but it helps break down some tissue that's dysfunctional, and laser is going to help the healthy tissue repair that. So good combo to have.
Yep.
I'm thankful to get it done.
And one of the nice things about the Shockwave, to nod off of what Dr. Nick said about the pain level coming down, is as we're doing the Shockwave treatment, we're actually pushing a hormone in the body called compound P, and that's going to actually help in the reduction of pain as well. So that's also another reason why, just in general, the hand, the wrist, doesn't really hurt as bad anymore. Alright, so let's go ahead and get started on the laser. Now, the laser is a little bit different than the Shockwave because you do have to keep the laser constantly moving. If we were to stop moving the laser, it would start to get significantly hot in that point of contact that we're making. So we don't have to keep it moving super fast, but just this nice steady movement that we have right here is exactly what we're looking for with the laser. Now, Dr. Nick already knows to let me know if it does start to get too warm, but the settings that we have him loaded up with, paired with some solid movement, shouldn't for any reason start to get too hot for him.
No.
So Dr. Nick, do you have any plans for Halloween? Halloween is coming up very soon, right around
Halloween's tomorrow. Definitely gonna dress up for it. I'm not gonna spoil what I'm gonna be, but I doubt this video will be up by tomorrow, so I'll spoil it. Who cares? Have you ever heard of? Oh, you surely have heard SNL.
Yeah.
Okay, the Jeopardy skits.
Okay.
Cool. It's one of the older ones. It's Burt Reynolds, where he goes by Turd Ferguson in it. So I'm gonna be Turd Ferguson for Halloween tomorrow.
Nice. Well, guys, if you want to come get adjusted by Dr. Turd Ferguson, just know by the time this video is posted, it'll be too late, but
there's always next year.
There's always next year.
I think a good portion of the office is going to dress up, and
oh yeah, we'll of course have Dr. Jeff in the Dracula outfit like usual.
Yep.
Dr. Jeff does his own makeup, for those of you who don't know. He loves Halloween, and every year he comes in as a nice and spooky Dracula. And I think the fact that he does his own makeup makes it even more spooky.
Yeah, seriously.
Because it is by no means a perfect makeup too.
It's not perfect, but it is pretty darn good. He's learned over the years.
But I feel like the imperfection of the makeup also adds to the character development.
For sure. For sure. One of these years we got so for the most part all the doctors dress up except Dr. Alec. He is the most stubborn of the group to dress up for it. So one of these days we gotta get him on board with partaking in the festivities.
Well, the problem with that is we've now given him scrubs.
Yeah.
He's going to tell everyone he's dressed up as a medical professional.
Oh, Brady, have you heard Brady's going to be pretty good. I like his costume.
Oh,
I
nice.
haven't heard about Dr. Warren's yet, though.
I gotta figure out something, that's for sure. All right, everybody. Well, that was the laser treatment.
Quick,
laser
easy, and painless.
Laser's never usually longer than about 4 to 5 minutes, depending on the target area. Obviously, some areas get a little bit more energy than others because, you know, more soft tissue, etc. But that was our treatment today for Dr. Nick. Hey everybody, it's Mike from Calcine Chiropractic, your local Baltimore Towson area chiropractor. I've got Bob here with me. We've been getting a little bit of carpal tunnel and is a little bit of a strain up here in the forearm. We're going to go ahead and be kind of focusing on those tendinopathies today. We've got our class 4 laser, so everybody in the room, of course, has our safety goggles on. And so let's go ahead and get things started. And so class 4 laser, like we've talked about before in our videos, is kind of the penultimate tool in terms of getting the body through the inflammatory healing stage. We all know that inflammation is the first step or the first stage in the healing process. So inflammation is good, but when we end up with so much inflammation that our body can't actually get rid of it all, that ends up developing into tendonitis and other tendinopathies that are basically inflammatory related. And so the laser is very, very, very effective at basically bringing in nice healing agents, nice healing properties into our targeted area, or essentially wherever this laser is going. And that can kind of get us through that inflammatory stage a little bit easier, a little bit faster, and ultimately make the patient have some greater results with their adjustments, have greater results with their functional strength, all of those good things that we want, obviously, to experience in our day-to-day life as well as our recovery. So Bob's been dealing with this problem for a fair bit of time now. Dr. Jeff's been doing some soft tissue work with him, really digging after everything that he really can. We're throwing the kitchen sink at him today with the laser, with the soft tissue work, and we're really seeing some good results so far. Bob, how do you feel like this is kind of getting for you? Do you feel like the laser last treatment was effective at all, or?
Most definitely. It's much better now than it was. I mean, it's now running on 60 days.
Perfect. Is that 60 days of pain, or it's been around for 60 days?
It's 60 days since it's been around.
Okay. And so that's still in the stages of the acute tendinopathies, if you will, but obviously being in any sort of discomfort for 60 days is not something that you want. So we're glad that we were able to kind of get you moving along and feeling a little bit better. So now
Most
we're gonna.
definitely.
Sorry about that.
No, I was going to say most definitely.
Absolutely. So now we're going to work up near the elbow area here. We've got our light force laser set to a carpal tunnel protocol. So it's just going to have the settings preloaded for us. Everything that we did up there on the wrist and in the carpal tunnel itself was already preloaded by the machine. And now same with this elbow here that we're hitting. All of our settings have been preloaded. The joules, everything, the wattage, all of that's predetermined. So we're just at this point doing a nice, essentially press and play treatment. So Bob ends up getting the laser before he sees our doctor, Dr. Jeff, because Dr. Jeff, when any of our doctors do soft tissue here in the office, you know, we take that can of Hunt's honey and we really dig into the muscles. But what happens is the Hunt's honey likes to heat up when you have the laser on top of it. So we don't want Bob to end up getting too hot, you know, end up burning the skin. So that's why Bob kind of gets that laser first before the adjustment itself. And the laser is nice too to just kind of start working out all of that gunk that Dr. Jeff is going to press his thumbs through and really dig after. So what ultimately started this carpal tunnel, Bob? Was it in recreational enjoyment, or was it a lifetime of work?
I guess it was a lifetime of work because it started in my sleep, to be honest with you. I thought I had fallen asleep on my arm, and the nerve just
Woke up with everything numb. Huh?
numb, yeah. And it's been like that in my thumb, I guess you call it an index finger, and then the middle finger has been numb.
Okay. And the laser feels like it's kind of decreasing that numbness,
Most
decreasing
definitely.
that sensitivity.
Yeah, most definitely. It feels like it is.
Perfect. Yeah, and we've got to eventually get it all localized and kind of calmed down to one spot. So, you know, as we start to see less and less fingers numb, or even just the intensity of the numbness going down, that's going to be how we kind of know that we're on the right track with our treatment that we're doing, and making sure that we're really hitting the nail on the head, so to speak. Okay, and so now we're going to just end up doing that bicep, tricep area, and then we will be all done with both the video and the laser treatment. So most laser treatments last anywhere from about 3 to 4 minutes, all the way up to, if you're doing a protocol such as this one, about 8 or 9 minutes, give or take. The laser is very powerful, so just like our Shockwave sessions, it doesn't have to be 10, 20 minutes long. Now there are some 20-minute long sessions if we're looking into peripheral neuropathy, but for the most cases, you're looking at about 4 to 5 minutes for a laser session. If you've never had the Class 4 laser before, it's a nice warm massage ball roller. If you can kind of see, I'll pause Bob's treatment. If you can kind of see, this is just a nice little massage ball that rolls around and it starts to warm up due to the laser. A lot of misconceptions is that the laser's healing property is the warmth or is the heat, but that's actually just a byproduct of that red light that you're seeing there. So if a patient ends up getting uncomfortable, feels like it's too warm, we can always turn it down, and that doesn't affect the treatment itself, doesn't kind of hinder it. It's not a no pain, no gain situation. And you hear us say that a lot because ultimately all of our modalities are going to be measured by patient discomfort, and we don't want to end up having past a tolerable amount, essentially. So Bob, you doing anything for the fall season? You gonna go to any pumpkin patches or apple orchards, anything fun like that?
Nothing planned now, but that's definitely an idea.
We got to get this carpal tunnel taken care of, and then you'll be out picking apples like everybody else, right?
That would be good. Looking forward to it.
So you a golfer, Bob?
No, I'm not.
What do you like to do in your spare time?
I do a lot of running.
Okay. One of our partners here in the office is actually Charm City Footwear. Have you ever been down there?
Most definitely. Yeah.
Yeah, they're a great little shop out here. Well, I say little, they're not little at all, but they're an awesome company to work with. We're glad to have that deal with them.
They do a lot of work with the running groups.
Exactly. Yep. And we're excited also to get into that field as well. We're gonna start kind of hosting our tents. We'll occasionally do kind of pop-ups, if you will, at CrossFit events. So we'll do free adjustments. And I know the doctors were actually wanting to start getting into the running events as well. So it's a nice contact to have for sure.
Yeah, definitely.
All right, so that is our Class 4 laser treatment today here with Bob.
How's it going, everybody? It's Dr. Nick here at Chiropractic, your Baltimore area chiropractor. We're here today with Jayla.
Hi.
Lovely CA, who has wrist pain that's been going on for
A little while.
more than a day. How long? Since college.
Yeah, since college started. I now graduated, so that's
So maybe
helps.
4 years?
Yeah.
5 years-ish?
Yes.
She played field hockey. She did cheerleading, and she gets in a lot of bar fights.
Not a lot.
Okay.
So, okay.
But I recently did a quick little exam on her wrist, and she has a lot of hypermobility, so she's got a lot of joint crepitus. The carpal bones in her wrist like to bump up against each other a lot.
Sorry. I'm so sorry.
And I wonder why she's got wrist pain.
She's
always trying to adjust her wrist.
I'm just moving.
So, based on the exam, based on what I'm finding, I do not think Jayla is a very good candidate for manipulation of her wrist. She already moves too much. I'm not going to induce more movement in it. That's just going to make her feel pretty cruddy the rest of the day. So, I think she's short term, especially if she gets in a pinch, if she's being active and she doesn't want to suffer through some of that discomfort. I would recommend she straps or tapes over those carpal bones just to keep everything nice and tight. But ultimately, I want to get her on focused Shockwave. I want to get her on laser therapy, help adjust or address some of the pain and discomfort she's getting. But long term is teaching her not to adjust herself so much. But no, strengthen up the muscles that support the wrist. That way we're taking as much pain or stress, I should say, away from the passive tissues being the ligaments of the wrist. Give her a little bit more structure and support. That way she doesn't have pain whenever she does more than one laser a day.
Yeah.
Cool. So we're gonna go start off with focus Shockwave. We'll jump to laser and we'll have Carly follow along for the whole thing.
Hey everybody, it's Mike with from Calcsign Chiropractic. I'm here with Jayla today. We're going to be doing a continued treatment from Dr. Nick's adjustment that he just did, and we're going to be doing some focused Shockwave on the wrist here. So Jayla, as you know, we're going to be sitting around 3 or 4 pain or pressure. So just kind of let me know as we start to get into that area there. And why don't you tell everybody just kind of what's been going on with the wrist?
Sometimes I'm having like pain issues with my wrists. Like if I'm doing something too long with my hand, it's causing some discomfort, and I have a tendency, like Dr. Nick said, to self-adjust. I didn't know I was self-adjusting. I thought I was just, shaking out my wrist. It's because it's uncomfortable. That's good, Mike. Maybe a little lower. There we go. Okay, yeah. So I've been self-adjusting, and apparently that's not good, guys. So every time I do that, I try to shake it out to help it. It doesn't really do anything, so I don't know why I do it, but that's just a habit, and that's just something I need to stop.
Yeah, we never want to self-adjust. A lot of times what self-adjusting does is you're just moving the ligaments that are already moving really well, and you're not actually freeing up any space in the areas that you're actually locked up in, which only kind of throws you down a deeper rabbit hole of being a little bit more locked up in that area. So it's best to always avoid those self-adjusts that kind of involve, violent movements like cranking on the wrist, or even the famous chest turn that everybody likes to hit for themselves. So how is this feeling right here? I know you said it was a little bit intense a second ago.
It's still pretty intense. I can feel it in my fingers. But yeah, I'm able to do it. Maybe no more than this though.
Gotcha. And we won't turn it up anymore.
Okay.
We're right at a therapeutic level. A lot of times patients will think that it's a no pain, no gain sort of situation here with a lot of the modalities here in the office. Shockwave, dry needling, even heat and stim, if you would believe it. And that's usually not the case. For focused Shockwave, we tell people we want like a 3 or 4 out of 10, but a lot of times we just want it strong but comfortable ultimately.
So it's definitely a weird sensation.
Oh yeah, it's even weirder how you don't really feel any contact at all on the skin, minus the applicator actually gliding over it.
You haven't had it yet?
Huh?
You haven't had it yet?
I've had it for like a second in like my elbow just so I could like try to explain it to to the patients, but I haven't had it in an area where I'm slightly injured.
Well, that's our 1,000, which is, you know, just kind of the minimum patient, I guess, kind of therapy, if you would say.
No, Jayla is so lucky and so fortunate to get her actual doctor to provide more treatment to her. So Mike, if you
So
just, Mike just finished up Focused.
Yes.
It's kind of uncomfortable for Jayla, to be expected. It's a very sensitive area, very sensitive tissue on her right now. But
Yes.
we got a therapy dose on her. That's all that matters. And we're gonna follow it up with laser, and hopefully she feels pretty good afterwards.
I hope so too.
Are you ready?
I am ready.
I'm glad you're so excited.
I'm so excited.
It's like one of those big pencils that you got from the bookstore.
Yeah. And
Let me know if it does get too warm, okay?
Okay. Yeah. And we used to try to use those as kids, and our hands were too small for that ginormous pencil.
And the eraser was absolutely terrible.
Yeah.
All right, it's fall time. The air is getting crispy. The leaves are getting even crispier. Scholastic Book Fair rolls into town. Your mom gives you $20. What are you getting?
I was definitely getting anything fun that I can put in my pencil bag. Or I was getting a pencil bag at that. That's exactly what I've been getting. And of course a book, because my mom would require that I come home with a book. And then I could get something fun. Yeah.
Those scratch and sniff pencils, oh my gosh.
Oh, those?
I like the smelly erasers.
Or the
Yeah, the erasers. Yeah, I had the erasers.
Or the pencils that were like super bendy.
What would you guys say if I was too young to know
To
what this
remember.
is?
You're like, we only had
It's like, I'm kidding.
book fair on
I'm like, did you just...
Lie? No,
Oh my
I had
gosh.
it. I had it. All the way up until middle school.
If y'all remember the Magic Treehouse books?
Yeah.
Yeah.
I used to rock with Junie B. Jones pretty hard.
Junie B. Jones for sure.
Never read Junie B.
She was a pretty
Flat
cool gal.
Stanley.
You're a boy.
You ever do Flat Stanley?
Yeah, but that wasn't a book for me. I just
I don't know what
had
Flat
a
Stanley
guy.
is.
I don't know what Flat Stanley is. Diary of a Wimpy Kid was my era.
Correct me if I'm wrong, but I'm pretty sure the backstory is that Flat Stanley got ran over by the bus.
Yes.
Yeah.
Sure. And then I said my
pretty dark.
Exactly. A little kid getting ran over by the bus, and he has to live the rest of his life being
But the
paper
thing
thin.
is, you make a Flat Stanley and then you send it to your family or something, and then they go around taking pictures with the Flat Stanley. So his life isn't unhappy. All is fine, I think.
Okay.
Except for
I
the
love
fact that.
that.
He got ran over by a bus. Is this okay for you? It's
Yeah.
not too warm.
It's warm. Like lukewarm.
Lukewarm.
Maybe a little warmer.
Maybe a little
than
bit warmer than that. Like hot tub warm, maybe.
Yeah.
Jacuzzi warm.
Definitely not jacuzzi warm. A little less. But it feels nice.
What about the Ripley's Believe It or Not books?
Oh, I had
No.
so many of those, and the
Guinness book.
Guinness Book of World Records.
But
Ooh.
And now there's like a Guinness World Record for everything, so those books would be thick.
Yeah.
it's the best because it was like reading, but you would just flip to
It's
a
just
random
pictures,
page
yeah.
and then read
Definitely.
about random stuff.
Is it really reading, or is it just looking?
It's looking.
I guess it's both.
if
but
you
it's
actually
pictures
wanted
versus
to
words.
read, then you could, but most people probably didn't.
Old school Guinness books didn't have pictures, I don't think.
They just said
definitely
the
did.
words?
No, they
I
definitely
was supposed to say,
did.
that's pretty sad.
Just, don't you dare spread misinformation. They definitely had photos.
Okay.
You're done. How'd it feel?
It felt good. I like this better than the Focus Shockwave. But yeah, it
That's
felt
why
nice.
you're getting both. It's like a little treat afterwards.
Yes. A little spot treatment.
Guys, if you have any questions on any of the modalities we had, but more importantly about wrist pain, causation, feel free to leave questions down in the comments below, and Jayla herself will actually answer those.
It will be me.
Because she's a professional.
It will be me.
And
I know
we
everything now.
trust in Jayla's
Judgment.
professional opinion.
I can do it.
We'll see you in the next one, guys.
Hey everyone, Dr. Warren here at Kelstein Chiropractic in Baltimore, Maryland. Michael Howell here. He is at Salisbury. He's been an intern here in the past. He's gone through way too much with his wrist and having to get surgery on it multiple times. So I'm going to be doing some soft tissue work with him, and we're going to be asking him some questions about kind of what he's expecting to do and what would be a good outcome for him over the summer internship that he has lined up through his school.
Yep.
So we'll jump into that. So he just got he had an honor variance on X-ray. We sent you over to Forthman. I think you kind of helped you at first, and then you went to another group to get you in a little bit faster, so that he could potentially work over the winter break. With those type of things, when they're painful in nature, when there's compression or irritation on the joint over time, he had some tendonitis going on as well. Long story short, this bone is jamming up into his carpals, into his wrist, and then in order for them to fix that, they go in and they surgically break his ulna, and they shorten it, and then they attach it with steel plate. And they do anything at the top for you there?
Yeah, they had to fix the cartilage again too.
Okay, so they'd go in there and do
TFC.
an debridement probably on the UFC, where they're going in and they're just cleaning up some of the scar tissue. And so we are on the back side of that doing PT and some modalities. He just had dry needling done over the scar and over the the top of this inside of his elbow. So he's having on his flexor carpi ulnaris, where he had some trigger points, pronator muscle here, and then I really worked his kind of UFCC and as well as his scar tissue there. We on the same page?
Yep. Perfect.
What did I miss?
Nothing. Perfect.
What did I miss?
Perfect. No, it was good.
You're back at school in the spring.
Yes.
You are also thinking about this thing right here, which is chiropractic school in next year, and in the fall. He's kind of looking at PT schools, chiro schools, and he's kind of settled on wanting to have a little bit of the manual side of care. I think he fits nicely into that too. And he's crushed it here at work too. Look at that for me, brother. Done a really nice job at work, professionally as well as just wanting to learn, wanting to grow. So I'm excited for you this summer.
Thank you.
Yeah. Got to see your family through the years coming through here. All the cross players, and the youngest gun is going to be potentially the pretty successful one of the group.
Hopefully, with the cross.
Yeah. All right, so you've got this summer coming up. You got 3-4 months. Save up a little bit of money. Get ready for school. What do you want to have happen over the internship that you think would be successful for you?
I don't know. I definitely just want to get back in the office, get hands-on with patients, and just learn. That's really what I love doing, is just learning.
Nice.
Going through all these injuries and playing sports and things like that kind of really brought me to this whole thing in the first place. So just want to keep going with it.
Take your time. If this bothers you at all at this point, interrupt me. Okay. That's your motion. Okay. Yeah, that's good stuff, man. Have a little bit of fun. See your friends before you head out too.
Yeah.
Hopefully. Graduate technically in the spring. He's going to do his internship in the summer because of this wrist. So we've got him coming in, and then he'll graduate, and then you'll try to head out right to chiropractic school.
Most likely, yeah.
You gotta look at a couple different schools in the areas. There's not any in Baltimore.
Nope.
It's University of Pittsburgh. They're one of the best PT programs in the country. And I don't know much about the program, but I know that they started a. There we go. You okay?
Yeah.
Hello, Baltimore. It's Dr. Jeff Kelstein, your Baltimore area chiropractor with Kelstein Chiropractic. And I got my buddy Bob with me here today. So this is a follow-up visit, sort of, right?
Yes.
We did his history a little bit, and we've put him under active care where he was getting manually adjusted. We were doing some soft tissue work on his flexor mass, or his forearm, and a carpal tunnel, and we were doing some laser. We also introduced some taping too. So I just want to get a benchmark on. Go ahead and turn your head to the left for me as far as you can go. Any discomfort in your neck at all?
No.
Yeah, does it cause any sensations down your left arm at all?
I can't say it does. No.
Okay. Now go back to the other side. Go to the right. Yeah. So go ahead and face Carly so they can see this. Go ahead and face her there. Turn your head to the left, and I'll come back to the right. Okay, so to me he's a little bit restricted going to the left, but not as restricted as you were when you first came in. Bring your chin to your chest for me all the way down. Does that bother you at all?
No.
No. If I put pressure on you, does that bother your neck or anything down your left arm?
No.
Go backwards for me. Does that bother you at all?
No.
No. I want you to stay back. I'm going to put some pressure down. Does that bother you?
No.
Now, turn this way for me. Bend your head backwards towards me. Does that bother you at all?
I can feel it a little bit on the side here.
On that side. So if I add some pressure, does that bother you?
No, it
No.
doesn't hurt.
Yeah, go this way and come back. Turn this way. Does this bother you?
No. I could feel it, but I mean,
Where do you feel it?
Down in this area.
Down in that area there. Okay. Now face me a little bit this way. So let's have you tilt your head away from the shoulder, like right there. If I press down on that shoulder, does that bother you?
No.
And let's go this way. If I press down on that shoulder, does that bother you?
I can feel it.
Where do you
It doesn't
feel that?
bother me.
Feel it right in there.
Right in there.
It feels different than the other side.
Yeah.
It feels tighter. Yeah. Bring your arms out like this for me. I'm going to push your arms in. Resist me. Good. Bring them up like this. Turn your hand towards me. Hold that for me. Resist me. Resist me. Are you right-handed or left-handed?
Right.
Right. Hold that for me. Hold. Don't let me pull that away from you. Hold. Great. Turn it toward this way. Big fist. More towards this. Push this into my hand. Great. And let's do the same thing over here. Go ahead and push in. Good. Bring it like this. Turn this way. Push into my hand. Go ahead. Push. Push. Hold that. Come on. There you go. Does that feel as strong as the other side?
The left arm doesn't, no.
Yeah. Go ahead and take your hands like this. Cock your wrist up. I'm going to pull that down. Resist me. And resist again. Hold it again. Hold it again. Okay. Here, cock your wrist up. Hold that for me. And cock this wrist up. Hold that. Okay. Flip it back over again. Cock your wrist up. Hold that for me. Hold it again. The reason I'm doing that a couple times is I want to see if I can fatigue them. So let's compare these two again. Bring them both up. Compare this side. Hold that. Hold this one. They feel as strong?
Again, it doesn't feel strong
Doesn't
on
feel
the
strong.
left side.
Yes, and I feel a little bit of weakness in wrist flexion also, okay? Now, while we're here, let's just open your hand up for me. If I touch like this, tap like that, does that bother you?
None.
No.
No.
Let's try this one. If I tap like that,
I can feel it.
where do you feel it?
Right in here.
Right here? Yeah. Does anything go down and travel into
Into
your
the
hand?
fingers, so, yeah.
Yeah, which fingers when I do that?
Into the ears.
Yeah, okay. So now go ahead and index finger, thumb, hold that together. Hold this together. Hold that. Don't let me pull that apart. Hold it. Hold this one. Any difference there?
Feels stronger on the
How about this
side,
one?
weaker on the side.
Now do your little finger, thumb. Hold that. Hold that again. So this is a comparison. That's still much better than it was when he first came in here. Before I could take my little finger and just pull them right apart. I can on this side, but over here he couldn't even maintain that pressure on my little finger before. It just would pop through like that. Okay. All right. Hands like this. Fingers closed. Push your fingers up into my hand. Push up.
Push up.
Up. Yep. Same thing over here. Push up. Good, good. Now, turn them over like this again. Keep those tight together. I'm going to pull them apart. Hold them together. Hold them together. Same over here. Hold them together. Hold them together. Hold it together. Okay, good. Now turn it over. Hold that for me. And same thing over here. Hold that for me. Okay, good. Like this. If I touch you on the outside of your index finger, does that feel equal?
I feel it more of a, I feel it more in the right hand than I do in the left hand. against
So,
that
so
index
it's a
finger.
lighter, it's lighter.
Yeah.
So if that was $1 worth of touch on this right side, what does that equal to? 50 cents, 75
Yeah,
cents?
60 cents. Yeah.
60 cents, yeah. How about on the thumb?
I agree with the same.
About 60 cents?
Yeah.
Real wide on your fingers for me now. How about on this middle finger on the inside?
That's probably about 70%. No, I'm saying 70 cents to the negative.
Yeah, so it's like 30 cents.
Yes.
So we're 30 cents here, we're 50 cents here, and we're 50 cents here. Okay. All right. What we've been working on when he first came in was was really restricted in his motion to his left, and he had what I call a positive Tinel sign at the wrist where it's irritating that median nerve. And so we've been adjusting his neck. We've been doing some laser on his wrist and on his flexor mass because the median nerve passes under a muscle there and also passes through the tunnel here. So it's these compression syndromes we talk about. Like I think you have like a triple compression syndrome. One in the neck, one in the wrist for sure, and possibly one here in the forearm too, okay? So let's have you lie on your back for me. He's complex. Overall, would you say you don't even think you had a neck problem, did you, when you walked in here?
No, I didn't.
No. Has your movement of your cervical spine improved since you've been here?
I think it has.
Yeah. So I'm at the level at C5, 6, C6, 7. And I just want you to relax. Hands on top of your tummy and just relax. Did you hear that?
Oh, I heard that.
Yeah, was that uncomfortable at all?
No.
No.
It wasn't. Surprisingly, no.
Yeah. Well, you're used to it now, right?
I am.
Yeah. Were you anxious the first time you came in?
Oh, most definitely.
Yeah, yeah. How about now? How about now?
No, I'm not.
Not so bad, yeah.
No,
Okay, so come on over this way for me. And the second thing I want to do is I'm going to get some of this. We'll use this ointment by Hans Honey. It's a non-profit down in the city that has some really great work they do for women down in Baltimore City. So the other thing we started doing was taping because it bothered you when you were driving. It bothers you when you sleep too, doesn't it? Yeah. Okay. All right, so let's go ahead and you should know the drill by now. No, close it, roll it up. Yep. So the carpal tunnel right in here. I'm just going to reinforce that. Go ahead, open your fingers, and then extend your wrist. Beautiful. Back. Let's do it again. Go ahead and do it. All the way open, all the way. Extend it. Beautiful. One more time. Go ahead and open. Extend your wrist. Yeah, very good. Back up, close it. One more time. All the way back down. I slipped off that one. Go close it again. So I take my thumb and I take that contact right below his carpal tunnel, and then go ahead and open. Extend your wrist. I'm trying to get that median nerve to glide through there. We were doing some nerve flossing with him on his own too. Do you remember that? Where your hand was over your head, we reached out like that?
Yeah.
Have you been doing any of that at all at home? You have?
Occasionally.
Occasionally? Okay, close your fingers. Cock it up. Now go ahead and go. Open. Beautiful. Beautiful. So now let me have this like this. And so we'll turn this way for Carly. So go ahead and just relax your arm. Let me have it. And this muscle is called the pronator teres. So again, this is called active release technique, where we shorten the muscle, then we try to elongate it and take some of the tension out of that muscle. Open. All right. And relax. I try to get a little bit of mobilization into his wrist. Okay, now, so I'll step over here again. Sorry to get in your way. Let me, face Carly. Turn your head to the right for me. Yep, now go to the left for me. Yeah, see, his cervical spine really responds well to the adjustment now. Now let's go like this again with our index finger. Hold this one again. Hold it. Hold this one. Hold it firm. Okay, and little finger, thumb. Hold that for me. Hold that. Okay. So this finger, index finger, hold it together. Does that feel stronger?
It does.
Yeah,
a little bit.
Let's try this one. Go ahead. Does that feel different? Mm-hmm. Yeah. So I think we're positively influencing the pressure on the nerve with the treatment. You have to wear that tape, all right? Especially at night. And we were talking before we went on air, we were talking about how you sleep, right? And I think part of the problem, it aggravates you when you're sleeping mostly?
Yes.
Yeah, it wakes you up.
It does.
Yeah. How about driving?
When I'm holding the wheel.
Yeah, so he reported that to us, then we started taping his wrist again, and when you did that, did it help with the driving?
It did help.
Yeah,
Really.
and what's the most comfortable way of sleeping for you?
On my back.
On your back, yeah. What's the worst?
On the side.
And so I think what happens for a lot of people is when they get on their side, they roll that wrist over and it compresses the wrist. So this is a unique case. He's got a couple things going on, right? He's got some cervical spine involvement in it, and he definitely has some carpal tunnel in it. So we've been going twice a week. We've been doing this for about 6 weeks. Overall, he didn't even know he had a neck issue, but so I wouldn't even ask for improvement there. How do you feel like that's going? 50 or more, 50 or less?
50 or more.
50 or more? Okay.
I would think, in the 60 to 65 range.
Yeah.
Better.
Yes. Is it still interfering with daily activities?
Yeah, it's just a feeling of numbness in these 3 fingers, or in the thumb and the 2 fingers.
And more so out on that index finger. Yeah, that's the. So we talked about maybe possibly getting some diagnostic, a nerve conduction velocity test, so we can see where potentially see if we're missing anything on where the compression on the nerve is coming from. So, all right. Anything else you want to share with us?
I don't think so. At
So
the moment, thank you.
We're treating a couple different conditions. I think we had cervical spine involvement, and I think we definitely have carpal tunnel involvement in it, right? And we're kind of we're trying to be like a sniper and identify what's working, what's not working. All right. So thank you. We'll update you. We'll let you know how he's doing. Okay. Thank you, Baltimore.
Like this. This adds a little je ne sais quoi to it.
You better believe it.
Yes. Oh my gosh.
Couldn't say
I'm
it
so
better.
glad.
I don't know where you left us off, but we cut out there for a second. But I was telling the journey about getting your stuff, taking it home. Your stuff being Dr. OG's Flex Balm. It's a menthol rub. It's got a lot of essential oils in there. It's got some really good healing properties as well. And you just know when something is made custom. You know when something is made that's legit. It wasn't fluff. Like I've had a lot of fluff out there, relatively speaking, with product. It's just loaded with menthol, and you can't even breathe. It's blue. It's like dyed blue. You know what I mean?
Yeah.
Natural. A lot of good ingredients in your stuff, and I felt it right away. And then my wife took the product and stole it from me, so I was forced to reach out to you.
Thanks, wifey.
For real. All the thanks to the wifey. All of it, honestly. And so, relative to that, I reached out. We've been using it in the office. So, all about the je ne sais quoi, if you will, right? When we do soft tissue work in here, we're doing stuff like this, dry needling, we do light therapy. There's a lot of different ways to make people feel good and move well.
It definitely boosts, it really helps. Wow.
Yeah, for sure. And you'll find a little bit more pressure through here. So, I'm palpating from my thumb to feel more density here. This is a common stress point. People are on their hands on their phones all the time.
Yeah.
You know what I mean? This area, it just stays flexed for a long time because of that. And people get kind of bound up here, if you will. So they don't really recognize it all the time until maybe something causes it to hurt and pain, and then the brain's got the message, oh, do something about this tendon that's been stressed. So you're like this.
Like this?
I got you, no worries. Like this. Flip it. Yeah.
Okay.
Roll your thumb over. Good.
Oh.
Now go ahead and push your palm to your arm. So you want to cup the whole hand around it. Yep, like that. Good, you're strong. And then roll your thumb over just a little bit. That's good. And then press down through here. Good.
Oh, wow.
Now slide down just a little bit as you bring your hand up.
Like this?
And now roll down as you do it. So here, now follow through. Good. Keep pressing.
That is crazy. What? Oh my God. Anatomy and physiology. I can feel like the muscles.
Yeah, all the fascia, all the tendons. This is a very simple thing that you can do to self-treat. You've got the product. Now you apply a little technique to it. And then boom, we're doing a Dr. OG sponsored class for at-home therapy on X body part. Right? We'll do a little soft tissue series. We'll spotlight you. We'll start with the forearm here, okay? And I'll show you how to do it a little bit more intensely. So bring your elbow into this position. The best place to do it, honestly, if you're lying on your back, because I can control the whole shoulder. But for the sake of the video, we'll show you and then follow through.
Wow, I can feel it kicking in too.
Yeah, right. I know.
Wow.
That 10 minutes, 15 minutes.
Yeah.
Don't touch your eye. You know what I mean? Don't get it anywhere sensitive, obviously. And then so I'm gonna work into that space a little bit. Okay. Extend your elbow. Good.
Wow.
Good. Pressure here. And so I'll push into that space. Relax. Good.
Wow. This is.
It's awesome. It's good stuff. You use your hands a lot, yeah?
Oh yes.
And so hand work, soft tissue work, relatively speaking, if I'm coming into the hands themselves, doing a little bit of stuff with this, making things all day long, I'm sure.
Wow.
It's lovely getting to meet your girls coming in here.
My
That's
God.
pretty special.
Yeah. Yeah, they're cool too. But this right here. This right here.
Right on.
Wow.
Here, easy. So you'll feel all the fascia kind of slide underneath my finger. Feel like almost like it's like a little crinkly paper under there. And you feel it all roll
I do feel it.
And then relax. Good. And I'm gonna work up into the tendons.
Wow.
See how ligaments are a little bit more sensitive? They have a different feel to them.
Yes.
They have a lot of sensory neurons in that area, so they feel good to get worked.
That is cool.
You just have to find the depth, the touch, and create traction on it.
I'm not even lying. Like, I never. Because, like, usually when I rub the flex palm, I just rub it on. But
Sure.
intentionally rubbing this on?
Yeah, and then you start to. So we'll go over the anatomy relatively speaking. You can kind of see, it's easy in the forearm to see. You flex back, you follow through. You can even see the tendons moving underneath your hands. If you look at your hand, it attaches up here. Same thing, but opposite on the front. You flip it, okay? Here's the flexor group.
Wow.
Here's here, here's there. Extend.
Wow.
So easy, little pressure. I'm gonna cup, I'm gonna press in, I'm gonna slide. I'm gonna do that smoothly so it's not so robotic.
Sheesh.
Right on.
I don't know what I've been doing ever since I've been making this bone. Like, what? I never thought to make. Like, because most people, they just rub it.
Yeah.
Like me. Like, I'm just. That is amazing. Like, I can feel like each individual ligament muscle.
Yeah, tendons, ligament, bone to bone, tendon, bone to bone from the muscle standpoint. Okay. So the tendons attach muscles to bone. Make sense? Ligaments keep bones together. Right.
Okay.
Yeah. Easy. Okay, so that's how I would use it on the forearm. There's a little bit more intricacies I can show you relative to the front of your arm. Come up on your back, I'll show you what
That's really cool.
We'll keep it consistent.
That
We'll
is
finish
really cool.
etc. Pressure. Open your palm for me. You got it. Now pretend like you're a server. Kind of turn your hand out for me a little bit.
Wow.
So there's a different muscle right here on the edge. Easy. Open up again. Good. You feel that?
Yeah.
I'm right on top of it. Now relax your shoulder. Good. You're gonna feel pressure. And I'm gonna put firm pressure down.
That is so cool.
And I'm gonna lengthen as I'm doing that.
That is so cool. Like, oh my, it really does work. Like, I don't know what I've been doing this whole time.
All right.
I'm gonna I don't know if I can do it like you, but I'm gonna try to be more intentional.
But yeah, if you understand some general areas, relatively speaking, I'll show you. Let me show you one. Let me give you one teaser, relatively speaking. I can bring you up. I got you. And so I'm going to take the trap muscle that's up here. Okay. I'm going to put compression down, and all you're going to do is bring your right ear to your right shoulder. Okay. And then I'm going to go ahead and take my heel of my hand, and I'm going to slide down the edge of the trap muscle. Remember what I said though, right? Be patient, because watch what happens when I get here. You get a deep pressure, there's a deeper sensation, and you'll notice that when I come back over that space a couple times, it'll be more intense each time. Go ahead, left to your left shoulder. Right to your right shoulder for me, take your time. Good. Take a deep breath in. Easy, relax your shoulders, there you go. I'm gonna guide you a little bit just to let you go. There you go.
Wow.
I'm pressing that way with my heel in my hand. I'm sliding along, I'm not trying to force it. It doesn't need a lot of force because I'm creating tension with her neck. I hope that this touches somebody out there and helps somebody. I already know you're impacting people here. Okay, I'm sure of that. I've already seen it and heard it from my patients. Yeah. Don't get it from me. Go to her website, support her. Cool.
Amazing. This is amazing.
Thanks for watching.
Thank you.